The government of Costa Rica's Ministry of Health is proud to announce our new Health Action Plan, a comprehensive set of guidelines for improving the health and well-being of all our citizens.
After analysis of the health status of our population, we have identified the key issues that need to be acted upon to create a brighter future for Costa Rica.
We begin with one of the most important issues facing our country, the incredible burden of disease associated with ischemic heart disease.
Ischemic heart disease has been identified as the leading cause of death-adjusted life years in this nation, accounting for about 8% of our burden of disease. Importantly, year-over-year increases in years of life lost as a result of ischemic heart disease have skyrocketed by 40% from 1990 through until the 2010s. In fact, it actually appears as though ischemic heart disease and other chronic cardiovascular diseases will only grow in importance as time progresses.
As we are aware that this category of disease is largely a result of personal health behaviors, we propose a new action plan encouraging the people of our nation to get up, be active, and adopt new healthy behaviors.
The new initiative will call for increased barriers for the procurement of cigarettes and anti-smoking promotion across the entire country, especially in high-risk environments such as high schools. Education about the dangers of smoking will also be instituted, something that should be realistically bring the rates of smoking down, since 92% of our population has some degree of education. Smoking is one of the leading risk factors of ischemic heart disease, and according to data from the World Bank, as of 2015, roughly 18.5% of Costa Rican males were smokers. We can strive to do much better to bring the percentage down.
Another key influencer on the ischemic heart disease is the lack of physical exercise and diabetes. We will continue to encourage more physical exercise and will invest our efforts in smoking prevention and encourage exercise by creating a decline in the ischemic heart disease by at least 50% prevalence.
We must also take steps to combat our second most common cause of death here in Costa Rica, one that requires interdepartmental cooperation in our government. This concerns road injuries, our fourth leading cause of disability-adjusted life years, and our second largest concern in relation to years of life lost. Unfortunately, we must admit that we have not done enough to combat this issue. Years of life lost have increased by 59% between 1990 and 2010.
It is absolutely imperative that we work with our transportation sector to help curb the number of years of life lost as a result of this key issue. We are proposing a massive reform of our transportation rules, and this starts by attacking its main risk factors at their core. Alcohol is a leading risk factor leading to increased transportation incidents. Now, in conjunction with our education reform on smoking, we'll also teach the dangers of alcohol consumption to impressionable young youth, which is a policy that has been adopted by many other countries across the world.
This also means that we will need to lobby to make road safety a top priority for our government, including the creation of a new road safety agency to oversee road, vehicle design, and be publicly accountable for transit incidents. This centralization of power will lead to a more responsible system for road management, instead of the current fragmentation of power that we have. Key talking points will include new seatbelt laws, alcohol prohibition while driving laws, and an increase in public transport, a move which will not only improve traffic accidents, but will also encourage more physical activity.
This must be a top priority since the number of vehicles in our country is only projected to rise, and safer roads mean a better economy. We have to drive our country's health forwards, not get caught up in a standstill. While over the last few years we've been implementing new road signs and rules in individual communities, it is clear that we have not gone nearly far enough.
This leads us to our final critical action point in our plan. Interpersonal violence is an unfortunate yet very real issue that affects many people in our nation. It is currently the third leading cause of years of life lost, and with a growth of 142% in the past 20 years. It is also the fourth fastest growing cause. Furthermore, it ranks in the top 10 causes of disability-adjusted life years. This is largely due to the result of drug, alcohol, child abuse, and partner violence. We believe that the recommended course of action to curb this growing issue is education.
Women are invariably the main victims of interpersonal violence. We will launch a new, expansive program highlighting the importance of respect for women aimed at the key aggressors, young men, and impressionable young children. This media campaign will make it clear that our country will not tolerate interpersonal violence.
Our plan transcends education, though. We also plan to clamp down on unfair persecutions from biased judicial and council systems. Instead of the broken system that we have now, where if an individual has enough money they can bribe their way to a court victory, we will ensure accountability, as well as implementing new measures for protecting women. This includes new reporting systems for sexual violence aimed at women who may not otherwise come forward with their crimes for fear of the repercussions. We'll also make sure that women know that they will be protected by our law.
Victim services will be expanded upon, including developing new infrastructure and services designed especially for providing safe counseling spaces. This development will also carry over into our judicial system, improving police response times and encouraging social assistance centers, all in the efforts of improving the overall health and well-being of our nation.
We will not call this a success until we can achieve at least 70% reduction in violence against women in this country.
We hope that this plan will usher a new era of health standard for Costa Rica by cutting our DALYs and years of life lost while implementing social change. We believe our health action plan is a step in the right direction on setting Costa Rica to not only become a health leader in the Latin Americas and Caribbean, but across the world.